Alright, to get the flu or the flu vaccine? Is that the question? Receiving the flu vaccine is a calculated action each of us should consider taking in battling this year's flu season. So today we're going to cover the flu vaccine, and the resources available to you to make those decisions. Most of the information I'm going to share with you today comes directly from the Central for Disease Control's website and from my personal experience as a respiratory therapist and respiratory care practitioner. So let's get on with the flu and its symptoms. First onset of the flu, you're going to feel achy. You'll have fatigue, sometimes sore throat, runny nose. You may have diarrhea, stomach irritability, sometimes fever, the chills, although the CDC tells us that fever is not an accurate indicator of whether you've been infected with the flu virus or not. Since the virus has many strains and adapts quickly, our biggest concern is secondary complications. During the time of you having the flu, you need to be concerned about upper respiratory infection, chronic bronchitis. Some of you folks will get even sicker with a viral pneumonia or a bacterial pneumonia. Those are severe symptoms that cause many deaths across our nation. The CDC makes a statement. Flu seasons are unpredictable and can be severe. Over a period of 30 years, from 1976 to 2006, estimates of flu-associated deaths in the United States range from the low 3,000s to 49,000 people. Thankfully, due to modern medicine, we have tools available to aid in your preparation for preparing for 2012's flu season. There are two types of flu vaccines that you can receive. The first one is the shot. The shot comes in three forms. The first form is called an intradermal shot, where it's entered just below the skin and is available for children 2 to ages 49 if you are healthy. The second one is called a high-dose vaccine, and it's available only for the elderly. Both of these vaccines are new, and they've only been introduced since 2010. The third type of vaccine that's available is the standard flu shot that we're all familiar with, the intramuscular vaccine, which contains 3 strains of a dead virus. And sometimes we get redness there, we get a little soreness, we might get aches and pains as side effects that typically will go away in a couple of days. The second type of flu vaccine that you can receive is the nasal injection. The nasal injection contains a live virus that has been weakened. Although you receive the live virus, you will not get the flu from the nasal vaccine. It also contains the 3 strains that have been identified this year as being the most prevalent. The CDC strongly recommends anybody over 6 months of age to protect themselves against these 3 strains. So, how do you make the decision what vaccine is right for you? You need resources, and good ones. The CDC website is an excellent resource for you to do further research into what type of vaccine is good for you and your family. There are many patients that are unable to take the flu vaccine because of health reasons. They may have congestive heart failure, diabetes, or some other underlying condition that doesn't make them a good candidate. So, as a respiratory therapist, I highly recommend tissue when you sneeze or when you cough, and dispose of it. Wash your hands. If you're sick, stay home. If you decide you don't want the flu vaccine, even though you're a candidate for it, I also recommend the same. The next I recommend, my little goodie is here, is good hand washing. Anytime you blow your nose or you cough, wash your hands. Anytime you're touching a table that people congregate around, or you notice there's been sneezing or coughing, wash your hands. Don't touch your eyes, don't touch your mouth or your nose. You may have contracted that and giving yourself that infection. The next resource you have and best ally in beating this year's flu season is your primary care physician. If you think you have the flu, go see your primary care physician. They'll be able to let you know whether they think you have the flu, and they'll be able to provide you with medications for the secondary infections that typically come along with having the flu, such as your upper respiratory infections. You could get a bacterial pneumonia. Most people get bronchitis, which often leads to pneumonia. For the elderly, unfortunately, it's often very, very hard on them. They make it into the hospital. I've had patients that have had to go on mechanical ventilation because of bronchitis and pneumonia until they've been able to overcome the secondary infection when they've already fought off the flu. Your next biggest resource is your pharmacist. When your primary care physician gives you those medications for those secondary infections, and you're questioning, well, why am I being treated for this when I'm here for the flu? Well, your pharmacist can explain to you the side effects and what these medications are for, how to use them, and whether they're going to interfere with the medications that you're currently taking. It is important to follow your pharmacist's directions on how to take this medication. This year's flu season has already began. Are you ready? Receiving the flu vaccine is a calculated action each of us must consider. 2012 flu season is upon us. You need to know the vaccines that are available to you and which one is best for you. So research it. Ask your primary care physician about what is best for you and your family members. The question truly should be, to protect against the flu, how can I be ready? Thank you.